normal, healthy bone density. If your score is -1 to -2.5, you have that low bone mass, and typically you're diagnosed with osteopenia. So if osteopenia isn't treated, it can turn into the later stages, which is osteoporosis. And then if your score is 2.5 or lower, typically that's when you have the presence of osteoporosis. So here are some risk factors for osteoporosis. We're going to be talking a little bit more in depth on risk factors that you can change. And these include low body weight, high sugar and salt diet, tripping or falling, physical inactivity, smoking and drinking too much alcohol, and caffeine. Risk factors that you can't change are more so like genes or family history. And a family history of osteoporosis-related fracture actually increases the odds for both men and women. However, osteoporosis is more common in women, and this is typically because female bones are a little bit smaller, their bone density is usually a little bit lower than male bones. And then with aging and menopause, the risk actually increases because estrogen falls, and estrogen has been shown to slow the natural breakdown of bone, which in turn prevents bones from getting weaker, keeps them stronger. So just a quick list of some medications that increase risk for osteoporosis. These are known to affect bone strength and bone density. So steroids, anti-epileptic medications, breast cancer, and prostate cancer treatments. And then these are just some medical conditions that are also known to increase risk and affect bone strength. And you know, the more common ones I would say are probably your rheumatoid arthritis, as well as conditions that cause long periods of immobility, such as stroke. So what we're mainly going to be covering are these 6 things in this presentation. So this is the non-pharmacological management. So calcium, vitamin D, and protein intake, weight-bearing exercise and muscle strengthening, balance program and fall prevention techniques, smoking cessation, and then limiting alcohol and caffeine consumption. So before we get into calcium, vitamin D, and protein, does anybody have any questions of what we've previously discussed about osteoporosis? Okay, so on your Word document, I've put a lot of numbers because with this nutrition section here, there's a lot of things that I didn't want you to have to worry about or memorize. So this is kind of what your Word document contains. So we're going to start with calcium. So calcium intake recommendations for someone with osteoporosis. So the recommended dietary calcium intake for men between 50 and 70 is 1,000 milligrams per day. For females or for men over 70, it's 1,200 milligrams a day. Now usually when you go to your doctor and they check these things, they usually recommend increasing your dietary calcium before your supplemental calcium, just because these sometimes aren't regulated. As we age, sometimes it can increase risk for kidney stones, different things like that. So we're going to be talking about what can we do to increase dietary calcium. So just some calcium-rich foods. You have your dairy products, which are yogurt, milk, and cheese, spinach, kale, other greens, sardines and salmon, tahini, and then fortified grapefruit juice or orange juices. And fortified just means that calcium and vitamin D usually go together, and they're put into these juices so you get those higher doses. And they do this with juice, milk, cereals, oatmeals, that kind of thing. So just a few dietary calcium examples here, and I believe all this is on your Word doc, but 1 cup of almond milk usually has about 425 milligrams. Your fortified orange juice has 350. Next is sardines at 325, and then 1 cup of milk has 295, and then you can kind of read the rest of the list there. So moving on to vitamin D, it's a key component in calcium absorption and bone health. So you need vitamin D for your body to be able to absorb calcium. And the vitamin D recommendation for men and women, 51 to 70, is 600 international units per day. For men and women older than 70, it's 800 international units per day, and in some sources I've even seen like 800 up to 2,000 international units per day. So it's a lot. So just some vitamin D rich foods. The big ones are the fish. So salmon, herring, sardines, canned tuna. Egg yolks are also another big one. Mushrooms, and then again your like fortified milk, orange juices, cereals, and oatmeals. And then for dietary vitamin D examples, so this is again like that vitamin D you're getting through your diet. A fillet of salmon, one fillet already has 815 international units, so this is a pretty big one here, and that's already your daily dose. Sardines are at 330, canned tuna, 269, and what I really want you to look at is down here. So one large egg yolk, and this is from a hen raised indoors, is 37 international units versus a free range hen or a hen raised outdoors for 51% of their life or more. It's 3 to 6 times more vitamin D in these egg yolks. Wow. Yeah, that was surprising to me. So you're getting from 37, you're getting 111 to 222 international units a day just from those free range eggs.
If you buy free range, are they always raised outdoors? Do you know?
So free range just means that they have to be raised, like, or have access to the outdoors for 51% of their life. Okay. So that's kind of what that free range means. Yeah.
Yeah, because there's so many different words and labels now on eggs
Oh,
that it's confusing.
It's so hard.
So I wouldn't go by natural or
Cage
whatever.
free, yeah.
So yeah. I think it does have to be like a specific, like free range, or even organic doesn't mean free range.
No,
so
right. Cage free also outdoors, which is good. Yeah, cage free is good. Yeah. So the other place that you can get vitamin D is actually from the sunlight. So skin exposed to sunlight increases vitamin D production, and this actually means like going outdoors. So through a windshield, through a window, doesn't count because those rays that help produce vitamin D are like being blocked. So even though you're getting sunlight through them, you're not typically getting that like vitamin D production. So typically the best time for sun exposure is around noon, and then all you need for your daily dose of vitamin D is 10 to 30 minutes of sunlight. And this varies from person to person. It varies with skin type. So, yeah, that's good. So we're going to move on to protein and bone health. So maintenance of adequate protein is important for the preservation of the musculoskeletal function in postmenopausal women and men over 50 years old. And I would argue this statement is true for pretty much any population for preservation of that musculoskeletal system. So we're going to kind of go into like a practical example here. So your recommended protein daily intake is 1.2 grams per kilogram of body weight daily. So to give you an example that makes sense, if you take someone that's 150 pounds, bless you, if you take someone that's 150 pounds and divide it by 2.2, that's your like pounds to kilogram conversion. So you end up with 68 kilograms times 1.2 grams. So this person who weighs 150 pounds should be eating 81.6 grams of protein per day. Okay? Does that kind of make sense to everybody?
I have a question. What about animal protein versus plant protein?
Great question. They are coming up on our next slides.
We're just ahead of ourselves here.
We have it covered. Yes. So, a serving size of meat, we're going to talk about animal proteins first. So a serving size of meat is 3 to 4 ounces or a deck of cards. You can also use like the palm of your hand as like that serving size. So 3 ounces of steak has about 21 grams of protein. 3 ounces of chicken breast, 26. 3 ounces of salmon, 17. Now keep in mind, when you go out to a restaurant or you're eating like a full chicken breast, things like that, it's usually like a 6 to 8 ounce serving. So you're kind of doubling these protein measurements here, okay? So other protein sources, and these are going to be more like your plant-based sources besides the eggs. So eggs is another source of protein, quinoa, green peas, nuts and seeds, and beans. Now, as for plant-based proteins, quinoa is the only complete protein. So this is a protein that, like your animal proteins, has all the amino acids and everything you would need. Not saying that these plant-based proteins aren't beneficial, because they still are. You're just not getting those complete things for your nutrition.
What about protein drinks?
That's a good question, and I don't know a whole lot about protein drinks, but typically they have in one setting. You want to watch for sugar on those, and then typically they have a good amount of protein in one like serving size for that. So that's usually like a good protein intake. But again, you want to like look at the ingredients, see what's in there. If there's a lot of stuff in there that you don't know, like it's probably not the best thing to be drinking. You know, I think they're all a little different. So, protein supplements in bone health. The use of protein supplements in patients with hip fracture have actually shown to minimize bone loss, decreased risk of infection, decreased length of hospital stay, and increased functional recovery. Now, this is something that, again, you want to be talking more so like with your doctor, another healthcare provider, like what's going to be the best individualized plan for you? Like, should I be taking this stuff in more so through my diet? Do I need a supplement to help me as well to really get that bone density and bone strength?
Does that go for like some protein powder as well?
Yes.
Mixing it in with food?
Right, right. So we're going to talk about like a practical meal example here that includes your daily dose of calcium, vitamin D, and protein. And this is going to be for someone, again, who is 150 pounds, and we'll just say 70 years old, either male or female, okay? So for breakfast, having 1 cup, which is 8 ounces of 2% milk, 1 pack of instant fortified oatmeal, and you can even use this milk in the oatmeal instead of like using water, plus 2 free-range eggs, any style. So just from those things, you can see here, we have calcium at 485 milligrams, vitamin D at 481 international units, and protein at 21.2 grams. So even without that animal protein, we're still getting a good protein amount here. For lunch, we have a 6-ounce grilled chicken breast sandwich with 1 slice of cheddar cheese and then a spinach and kale salad on the side. Your calcium is at 322 milligrams, vitamin D at 7 international units, and protein at 52 grams. And then for dinner, 1 cup of fortified orange juice, a salmon fillet, and then 1 cup of cooked spinach. Your calcium is 396, vitamin D is 915, and then protein is 34 grams. So, just to recap, because I know this is like a lot of numbers and a lot of information, and all this stuff should be in your Word document as well. So, your goal for this person is to hit 1,200 milligrams of calcium, and we're just a little bit above that. Your vitamin D goal is 800, and we're way above that at 1,400. And then your total protein is 81.6 grams. We're at 107.2. Okay, so
That's for 1 meal?
this is for that whole day.
Okay.
So like breakfast, lunch, and dinner. So these are like the total things combined. Okay. Now, what you just don't want to exceed is more than 200 or more than 2,000 milligrams of calcium per day. And then the upper limit for vitamin D is going to be 4,000 international units a day. And with this example here, we haven't exceeded either of those. So we're still in those like safe ranges.
Why can't you exceed that?
That's a good question. I think like they just have recommendations on what not to exceed. And I think everything probably has some different reasons why. I don't know exactly why calcium and vitamin D, they have those upper limits specifically. My guess is probably your body can't absorb more than that in a day, you know.
And it all depends on what you have going on. I mean, for certain people with certain diagnoses, they're taking a lot of vitamin D because they're so deficient.
Right.
So again, it just depends on your doctor's recommendations for you as well.
Yeah, it's gonna be part of that like individualized plan.
And for us in like Pittsburgh, we don't get a lot of vitamin D, so I take one every winter.
Yeah.
Just to help me, or eat.
Like a supplement,
yeah.
yeah. Right. So does this seem like this meal example something that like would feel doable for you guys? Is that like a practical thing to eat?
The only thing I've been warned against was having too much salmon because of the,
Mercury?
yeah, what?
Is it the mercury in it?
Yes,
Mm-hmm.
because of the mercury.
Right, and this is where like you really want to know where your products are coming from. You know, like I think with salmon, usually like the wording on it is, what is it? Basically, they're almost like a free range as well, but the wording is something different. I'll have to find that out for you and look it up. But usually those are safer, more healthy options where you're getting more of those nutrients, kind of like the free range egg yolk. You know, so you want to be looking for these specific words on labels and things. Because a lot of times, like with fish, especially here, they have them in like farms.
Yeah.
You
versus
know,
the wild.
right. So wild caught is the phrase I think
Yeah.
that you use for something like that. And it is a little bit more expensive, but if you're willing to, you know, do it and change some things, I think it's all worth it. It's just going to be healthier for your body, healthier for bone and everything like that. And keep in mind, I'm not a nutritionist, so if you want to go more in depth with these things, like consulting with a nutritionist might be something that's good as well. Okay, so any other questions on that calcium, vitamin D, and protein intake? All right. So next we're going to move on to weight-bearing exercise and muscle strengthening. And I really want to emphasize weight-bearing exercise here because when you're in weight-bearing, meaning for the legs, you're in a standing position, you're putting your weight through those legs. That's really where you get that bone strength, increasing that bone density. So some examples for the legs are any exercises in standing: squats, deadlifts, sidestepping, stairs, dancing, exercise classes where a lot of the time you're in standing. As for the arms, your weight-bearing exercises are going to be more like planks, push-ups, tricep dips, and these are all included like if you're doing them modified at a rail or on a table versus all the way down. Anything where you're like putting weight through the arms, putting weight through the legs. Resistance and strengthening exercises, so like your normal resistance exercise, are still very important as well to keep bones and muscles strong. So an example of this for the arms would be like a bicep curl, an overhead press, anything like that. For the legs, it could be like a seated knee extension, a side kick, a back kick with weights or resistance for the hip, okay? And then I also encourage like flexibility exercises as well, just because when you have tight muscles, they tend to get weak, and weak muscles tend to get tight. So you want a good balance between flexibility and strength to really build up that overall mobility. Now, a lot of these programs can be given to you, and I'm sure a lot of you are already doing a lot of this stuff, especially if you're with Life in Motion. But Life in Motion, personal trainers, physical therapists, and then home workouts as well. Now, I just want to mention down here for the flexibility exercises, I do have yoga on here. This is something, if you have osteoporosis with, you want to be very careful with, because some yoga classes take your body to like extreme end ranges, especially for the spine. So in the next slide, we'll go over maybe some things not to do or to avoid. But like they do have some specific yoga classes like chair yoga or like a senior yoga class that are a little bit more tame and a little more safe for you to participate in and still improve your flexibility. So now these are going to be some motions to either avoid or be cautious with, and this is going to depend on the level of either osteopenia or osteoporosis that you have. So if you have more of like that osteopenia, maybe you want to be a little bit more cautious with these motions. If you're into that osteoporosis stage, these are maybe some things to avoid. So the first one is more so like trunk bending and twisting. So this is anytime you're going to like pick something up off the floor, you want to make sure that you're not getting this like bend here. You want to hip hinge, keeping that back nice and straight, if that makes sense. The other one is like trunk twisting. So that's in like a seated or a standing position. So again, if you're going to lift something and twist to put it down, you want to be very mindful of that. It's better to like lift, turn your full body, and place something down. And we can talk more about like lifting mechanics at the end if that's something you guys want to get into and we have a little more time. And then again, these like extreme spine, body, and ranges of motion. So with yoga class, for example, like a down dog might be a little aggravating. Any type of like back bend where you're really going to that end range are things that you just want to be cautious with or avoid. And then again, lifting anything that's heavy. And then those high impact activities such as like running, jumping, and sports related activity where you're putting a lot of pressure and impact through those joints. So typically there is pain as you get into those later stages of osteoporosis. So we'll just talk a little bit of pain management here, especially for the low back. So just some like short-term relief things that you can be doing. Ice or heat as long as it's comfortable and not worsening your pain. Topical creams for pain relief, so that's like your Aspercreme, Voltaren gels, those kind of things. NSAIDs or Tylenol, and NSAIDs just meaning like Aleve or Advil, as long as you're able to take these with like your other medications or your other conditions that you have. And then like we talked about previously, movement and exercise. So I'm just going to move to the next slide here. So this is the pain scale. So typically your lower levels of pain are between 0 and 3. Your moderate levels are 4 and 6, and then your high levels are between 7 and 10. Usually if you're doing an activity and you're in these high levels of pain, you want to stop the activity. You don't want to be pushing through high levels of pain. Now that doesn't mean that you shouldn't do exercise if you're in pain, because I think movement can be some of the best things that you can do to get that relief over time. And usually I say, if the activity increases your pain by 2 or more points on the pain scale, that's when you want to modify or stop the exercise. So say you're squatting and your pain is a 3 out of 10. With squatting, your pain increases to 5 out of 10. That's when you maybe need to modify the exercise, not going down as far or holding off if it's really worsening that pain. Any questions about like an exercise program for osteoporosis?
When lifting, should you be bending your knees?
Great question. So this is going to get into more of like your lifting mechanics. So there's a couple different like techniques that you can do. If you're lifting something like very heavy, you want to make sure that you're getting as close to the object as you can, spreading those feet wide, keeping the back nice and straight, and then sitting back like you're sitting in a chair. Grabbing and then coming up. So really using those legs versus bending over and picking up this way. Another way to do it is if you're like this, a chair on your side, and again, picking up with one hand, keeping that back nice and straight. So there are a couple different techniques you can use, but you want to make sure with all the techniques that you're doing, you're not hunching over this way, which is, you know, just an easy thing to do, I think. Right. And then Cher, did you have a question?
My question was, these exercises, what relationship do they have to reducing osteoporosis or benefiting?
Yes, so with any type of like that resistant strengthening that we talked about, it's good for your bones and muscles to build that strength. But the most important thing I would say is those weight-bearing activities. Because that, especially for like the legs, that really helps build up those, and for the spine, it really helps build that bone strength and that bone density. Does that make sense? Or did it answer your question?
Yeah, I guess I got derailed by another problem. I don't tend to break bones because I have Ehlers-Danlos syndrome.
Sure.
But, so I know that I'm supposed to strengthen to avoid things ripping, going the wrong way.
Right.
So I'm getting a little confused.
Yes, so a lot of these exercises can be beneficial for multiple conditions. So your weight-bearing exercises are still going to be good for your Ehlers-Danlos syndrome.
Okay.
You know, because strengthening helps that hypermobility to where you're not getting all of the extension, like the hyperextension and really like ripping, tearing, those kinds of things. Yeah.
Okay.
I think the main thing is just having someone that can guide you to do it properly.
For sure.
And within a safe range of motion.
For sure. Because a lot of these exercises might be the same, but you may be doing it a different way than I have Barb doing it because your range of motion is a little bit more. So maybe we're taking you through a more intense range of motion, or we're doing it in a different way where it's a higher intensity. You know what I mean? So it all varies person to person and what they have going on.
Okay.
And then Erin, did you have a question?
I was just gonna say, the weight bearing aspect of the exercise, it kind of challenges your bones to keep building themselves. Like when you lay around and you're not weight bearing, that stress from the weight bearing increases that cellular activity, so they will build a little more than if you're not weight bearing. Right?
Yes.
Does that make sense?
Yeah.
Yeah.
It's kind of like that time you like break down and it rebuilds more, stronger.
It kind of keeps it in balance more. Because your
Absolutely.
bones are reabsorbing as they're rebuilding all the time. So if one of those gets out of whack, they're reabsorbing too much because you're not giving them enough attention, basically, or enough stress, and they don't build as much to keep up with the reabsorption.
Yes, absolutely correct.
Very interesting. I haven't heard any of that.
Yeah, that's
I
why
know,
I
it's
combine
good.
it with a diet that focuses on it as well, is like replenishing all of that and helping build even more bone density and strengthen your muscles.
That's
Yes.
what, there's more than one element.
Yeah.
Oh, so many things. There's so many things. Which is good. It's good because there's a lot I think that you guys can take control of and you guys can like change. You know what I mean? So next we're gonna get into like a balance program as well as fall prevention techniques. So for balance exercises, which I know a lot of you guys are already doing, these just help decrease fall risk. And a lot of times initially, I usually recommend getting this program from like a healthcare professional because especially if you're at risk for falling or you've had multiple falls in the past, this is something that especially initially you want to be guarded for. So like we want to challenge the balance system, but you want someone there guarding you to make sure that if you do have a reaction, you don't fall from it. So typically a balance program is going to consist of like 3 different types of exercises. You have your dynamic balance activities, your reactive, and then your static balance exercises. So for example, a dynamic balance activity would be like an obstacle course where you're walking through and your PT has created something for you either to go around, step over, walking with head turning, backwards walking while doing a dual task. These are all like dynamic things. Your reactive exercises are going to be more to where you're not really like expecting it, but you have to react to the situation either through a stepping or through like that body reaction. And then your static balance exercise is going to be more like you're still balancing, but you're not necessarily like moving when you're doing it. So like a single leg balance, your tandem stance, or like balancing on a compliant surface like foam. Okay. So these exercises in this program is really just going to depend on what you need. So if if you have been referred to physical therapy or you have a program with us, make sure you're doing this stuff regularly, because with balance, flexibility, strength, usually it takes a while to improve. So usually I tell people 3 times a week for 6 to 8 weeks of a consistent program is really where you're going to see those significant changes. And that's usually how long it takes. Sometimes longer, sometimes you see those positive changes sooner. But yeah, it just depends on who you are and what you need. So to find a balance program, you can visit your local senior center. You can look online. There's always some online options, especially now with COVID and everything. And then bring a friend so that you're feeling more comfortable with it. And then this is just some information if you're trying to find a balance program in your area, you're not already part of one. This is a website for your area agency on aging, and then a phone number as well to find one in your community. So we're going to move into some fall prevention techniques, and if you guys were here for the fall prevention talk, this may be some review for you. Okay, so we're going to start with just conversations with your doctor here. So you want to talk to your doctor and you want to be honest about your falls, because they're going to be able to help you and guide you to the appropriate healthcare provider to kind of address these things. So again, you want to ask about other specialists such as like physical therapy, and I don't think doctors do this, but physical therapists can perform like a fall risk assessment for you. So this is basically just some tests and measures to really see like what is your risk of falling. Should you be using an assistive device? Are you using the right assistive device? Do you need one in the home? Do you need one in the community? Those kinds of things. And you want to be honest about your concerns, ask questions, take notes, and ask for notes. So usually when I go into my doctor's visits, I always take a list of questions that I have, because usually once I get in there, I forget everything. So just to make sure that I'm like covering what I want to cover in the visit, because sometimes they can be a little bit quick in and out. So just making sure that all your concerns are being addressed. As for medications, you want to be constantly reviewing these with your doctor, especially if you're taking multiple medications, because this increases the chance of side effects, drug interactions, and increases your risk for falling. So you want to make sure that you're taking them only as prescribed. You want to keep a list and set reminders, and then reporting any of the side effects that you're experiencing, and again, just being honest about those falls. So, fall prevention, sight and hearing loss. Sight is a big one here because it is the main thing that we use for balance. So as your sight tends to go, you see more balance issues, more risk for falling. And again, another good thing about getting on a balance program is we can challenge all 3 of your balance systems, including your visual system here. So you want to make sure that you are taking care of both your vision and your hearing, getting eye exams, checking for hearing changes with your PCP, and then lighting up your home. So this helps visually. So night lights in dark hallways, making sure if you're getting up to go to the bathroom in the middle of the night, you have night lights somewhere. So if you have carpets or anything like that, you can see where you need to step. So just some more tips to make your home safer. You want to clear the way. So this is more so just planning ahead, being mindful of the activities that you need to be doing throughout your day, making sure there's no obstacles in your way, kind of moving them ahead of time. So when you're doing those activities, you don't have to worry about a whole lot. And then just being aware, like if your stairs have carpet or you have like high rock, like a little step anywhere, just being aware of all of these things. Again, light it up. And then just keeping like a chair in your bedroom to sit down when you're getting dressed or putting on your shoes, so you're not trying to stand and like fumble around with those things. Okay, so for bathing, to make bathing easier, they have a ton of different support things that you can install in your shower. So that being a grab bar, adjustable shower head, they even have shower seats. If the shower's big enough, you can sit down while you're showering. And then anything that you're using throughout the day, especially frequently, making sure you're keeping them at either waist height or shoulder height, so you can easily like retrieve those things versus if you have to like bend down for something or reach up or have to get like up on a step stool for those things. So again, a lot of this is just being mindful and setting yourself up for a productive day and decreasing your risk for falling. Okay, any questions on like balance program fall risk? No. Good. All right, we're going to move into the last portion of our presentation. I know this has been a lot of info. So we're going to start with smoking. So smoking cessation just means like a plan for either quitting or stopping smoking. And you can talk with your doctor or another healthcare provider to kind of create this plan, set goals for yourself, and kind of wean down in the best way for you. So a reason to do this, just how does smoking affect your bones? So there are a few things that it does here. So it impedes the hormone calcitonin, and calcitonin helps build bone up. It kills osteoblasts, which are cells that make bones, and it increases cortisol, which leads to bone breakdown. So as you can see, just from these three things, it's throwing off that ratio of bony build to breakdown, because it's stopping the things that help you build bone, and it's increasing the rate of bone breakdown, okay? Additionally, it reduces blood supply to the bone and many other tissues. It can also damage blood vessels, which again limits that blood supply to bone and increases your risk for fracture. So it's throwing off that ratio, decreasing bone density, increasing your risk for fracture. So caffeine. Do we have any coffee drinkers in the house?
Yes.
Nobody drinks coffee? Aaron, Jackie, Esther? Okay, I'm a big coffee drinker, so this was like news to me. And caffeine can include anything like teas, coffee, energy drinks, that kind of stuff. So for someone with osteoporosis, and anyone in general, they typically recommend less than 400 milligrams of caffeine daily. 400 milligrams of caffeine is 4 8-ounce cups of coffee. Now, I just want to be clear in saying, you know, usually like a mug, for example, this is 12 ounces already. A lot of mugs are actually 16 ounces. And then if you go to like a coffee shop or like a gas station, you're getting like 12 to 16 ounces right off the bat. So your 8-ounce cup of coffee is right here. So here and down would be your 8 ounces, which I drink way more than that. So usually a trick that I found to be helpful is like, I'll just put like a scoop of decaf in with my regular coffee, and then I usually can't taste the difference when they're like mixed together. So you're still getting your coffee, but you're not having like as much caffeine intake there. So other sources of caffeine are black tea, Earl Grey, and green tea. And right here, this is the highest. Your Earl Grey is similar to like the caffeine that you'll get in a cup of coffee.
That's interesting.
Yeah, right? I think coffee is anywhere from like 96 to 100 milligrams. Your Earl Grey is 90. Your black tea is 50. Your green tea is 30. So these, you know, you can have like between your black and green tea, like 4 to 6 cups of those a day, and you're still like under that 400. And then decaf coffee only has 2 milligrams of caffeine. So how does caffeine affect our bones? Caffeine is a diuretic, and this just means that it's increasing the passing of urine. And through this increased passing of urine, you're getting increased calcium loss, which means your body can't absorb that calcium. So decreased calcium, especially over time, increases bone loss and decreases bone strength and density. Okay, so we're moving on to alcohol now. So the recommended alcohol consumption for females and adults over 65 years and older, no more than 1 drink in a single day, and no more than 7 in a week. And then for males, no more than 2 drinks in a single day, or 14 drinks per week. So how alcohol affects our bones: it decreases estrogen and testosterone production, and these hormones are used to help keep bones strong. It suppresses these osteoblasts, just like smoking, so these are cells that make bone. It decreases bone density and increases risk for fracture. So kind of similar to smoking, it like throws that ratio off where you're getting increased bone breakdown and it's taking away or suppressing some of the things that help build bone. And then heavy drinking in adolescence, so in your younger years, and early adulthood, leads to increased risk for osteoporosis later in life. And that heavy drinking is defined as any more than this, which was also surprising, I feel like.
And what do they consider one drink? I mean, size-wise, any idea?
Yeah, it's different for every alcohol.
Right.
So I believe like liquor or like whiskey, those kind of things is like a 1 ounce shot.
Okay.
Wine, I believe, is a 5 ounce glass. Beer, I believe, is 12 ounce can.
I think so.
Yeah,
Okay.
yeah. So depending on what you're drinking, and especially for wine, I feel like, you know, 5 ounces is maybe
Not much.
beer, you know, like,
Not the wine glasses they have nowadays.
right, right. Or if like you're pouring a double shot into one drink, that counts as 2 drinks. You know what I mean? So it's just, it's a little bit less than you think. So I know we've covered a lot of material. This is just a review. Okay, so for management and treatment of osteoporosis, some things that you can control here. Begin a plan for adequate calcium, vitamin D, and protein intake. Get into an individualized weight-bearing exercise and muscle strengthening program. Begin a balance program and use fall prevention techniques to decrease fall risk. Develop a smoking cessation plan and limit alcohol and caffeine consumption. Those are my sources. Thank you. Any questions?
Very good, thank you.
Yeah.
Yeah, very interesting.
Do you guys feel like you learned anything new from the presentation?
Yeah.
Okay,
I
good.
don't know, it would be nice.
What, some of these things, are they quantifiable as to increase in, or decrease in osteoporosis or any of these other things? What do I have to do? How much of it do I have to do?
Right, so this is going to be based on more of that individualized plan you come up with, you know, with a healthcare provider or a doctor, because it's going to be different for everyone. You know, it's testing those like how much calcium are you already getting? How much vitamin D and protein are you intaking per day? Do you need supplements? Do you need to increase your dietary intake of those things? I know you've started the weight bearing and exercise classes and strengthening, so I think that's a really good start exercise-wise. You know, so it's really just sitting down with the healthcare provider and creating that individualized plan.
What are these infusions that the doctor talks about and stuff like that?
That's a great question. I don't know a lot about the infusions or the medications, just because it's not my line of expertise. Erin might know.
I honestly don't either, because we have nurse practitioners who just, they know everything, and
They
so
do
I
it
just
all.
refer to them because
Yeah.
it's not my area of
Like a
expertise.
specialist, yeah.
Right.
We have a special program, and that's
Yeah,
all
so
they do. Yeah.
These might be conversations to more so be having with like a physician.
And I know just some people tolerate different medications differently for
Yeah.
bone health.
And it depends on what you're already taking as well,
Right.
because those drug interactions can be happening. So you need to make sure, like, you know, you're keeping track of all these things, and they can help you do that. You
And they would
know?
do all the blood work and stuff,
Yeah, they do
and
the blood
the
work, and you know,
bone
they can
density
find out your vitamin
testing,
D
yeah.
levels, and yeah.
So sometimes endocrinologists get involved in that.
Yeah.
And sometimes like the orthopedic physicians may specialize in that. It's becoming more popular.
Oh, cool.
We have a program at AHN, and it's just for osteoporosis patients. So the orthopedic physician runs the program, but these nurse practitioners do the whole intake evaluation. They look at everything, your DEXA scans, and then they give you advice with the medications, and then they refer you to PT. It's a special program. So it's like it's
comprehensive, it sounds like.
very comprehensive.
That's
yeah.
fantastic.
Yeah, so, and then they used to have a nutritionist on board, but he's not with us anymore, so he'll come and speak like once a year to us, like a quarterly support group, but the nurse practitioners can help you with like that aspect as well, so we aren't like allowed to talk nutrition or Or, you know what I mean? You give basic guidelines.
Yeah, yeah.
Totally fair.
But yeah, I mean, osteoporosis was kind of like, nobody really talked about it.
Yeah.
Mm-hmm.
For like, I've been doing this 30 years for like years.
Yeah, right.
And now in like the last
It's like, oh, you have
Last
osteoporosis.
six-
It's
yeah,
fine.
the
You're
last
getting
5
older.
years, the
No big
doctors-
deal.
The doctors don't even really get it. Like now they do because they're trying to
Yeah.
reach out. There are different groups that are trying to get everyone
Right.
better educated in the healthcare field in general, just to educate the public.
Well,
So this is really good. This is
Yeah,
very
and I think it all
comprehensive.
comes to prevention as well too,
It
for
does.
other things happening down the road
For
and
sure.
decreasing medical
How do you find
costs.
that in Allegheny Health Network? How do you get in touch with them?
I was supposed to bring brochures with me today, and I forgot.
Well, we have Erin's contact
But
information
yes, I
that
can
we
give you
could.
that information.
Yeah.
Yeah.
I
That would be
think
great.
UPMC may have a program as well, because I know
I would
sometimes with your
assume
insurance
something,
it
but,
matters,
yeah.
but I don't know anything about their program.
Yeah.
Yeah, if you
But-
could give us some information,
But
that
I'd
would
be
be
happy
great.
to share that, yeah.
That would be great.
And we'll pass around, if we want to pass around the sign-in sheet, if we
Yeah.
don't have your email, put it down. And then if you want a copy of the PowerPoint, or if you want Erin's information,
Mhm.
or information she has, just write a note on there and we can
Yeah.
give it to you.
Are there any recommendations for men to have DEXA scans?
I think they scan both men and women.
Yes.
Yes,
Yep.
they
My
do.
husband had one.
Age-wise or?
Yep. I think it's usually like postmenopausal and then over the age of 50 years old.
Also, if you've had cancer treatments, certain types of chemotherapy,
They'll do,
and you're
yeah.
male, they'll sometimes recommend them.
For sure.
Or fractures, things like that. If you get a compression fracture,
Mhm.
generally they'll recommend a DEXA scan.
And usually I think they're done like once you start doing them every 2 years to like see. Because a lot of these interventions can either be preventative or they can help kind of work towards that reversal.
Yes, is osteopenia, it can be reversed, is that
Yes.
correct? And osteoporosis, it depends, is that
Correct.
correct?
Correct.
I might have missed that if you
I'm a little
mentioned.
vague on that.
Yeah.
I mean, I think osteopenia, you can manage it better. I
For
mean, I know
sure.
you can manage it better than osteoporosis, but I don't know.
I agree.
That's something I need to do research on. 'Cause
Yeah.
people ask me that all the time. Well, is this going to make my bones stronger? Well,
Yeah.
to some degree, yes. But
Correct.
how
Now,
much, I don't know.
Is
you
it
know?
gonna really get you out of that osteoporosis phase or osteopenia
Right.
phase? I think it depends on where you're at. You know, those more severe levels of osteoporosis, it's gonna take a whole lot more than if you're in the osteopenia phase, you know? And it's tough to give you like an exact answer to that, because again, it's different with every person, you know?
The answer everyone loves, I know, but. But it is so
But,
very.
like in an ideal world,
But ask questions.
you
like,
do these exercises consistently, and then you somehow make them part of your daily routine.
Yeah, this is like a maintenance
Lifestyle.
kind of program, lifestyle. So like this isn't something where like you go to PT, you do it for 6 weeks and then
You're
you
done.
stop. You know,
It's
this is
you
something
need to
where
keep
you
doing.
wanna do exercises as long as you can maintain them.
So
Just
you,
like taking your medication.
right. And you may not stop and exercise every day for half an hour or 45 minutes. You may make certain things happen at certain times of
Mhm.
the day. You do squats while you're waiting for your coffee to brew, or
Right.
you do something you're balanced up while you're brushing your teeth, or like you just try to incorporate it into your routine
Correct.
so that you don't have to stop and exercise, because
Right?
generally you never get around to it, right?
Yeah. And you can break it up, like Erin said, in any way. Like maybe one day you focus on your strength stuff. Maybe one day you do balance. Especially for strengthening, I usually say 3 to 4 days a week with the strength program, or once every other day. You know, because if you're working especially the muscles every single day, it's going to make you super sore. Especially if you're doing the same exact exercises every day. You know, if you're working different muscle groups and different things like that, it's fine to do it, every day, but it just depends.
And if,
Go ahead.
I'm sorry.
Mhm.
If you don't have knee or hip problems and you have a walking program, you can mix that up, right? You
Mhm.
can do different walking. You can walk forward and backward and sideways and do different things while you're walking. You might look a little funny, but to make it a little more interesting, a little more diverse, so you're working different muscle groups while you're just walking. So you
Yeah.
can get creative with it, things like that.
Mhm. And yeah, and finding what you want to do and like to do and sticking with it. Whether that's at home or with a friend or in a class, or
Mhm.
if you know you're not going to do it, you just need someone to tell you. I mean, you find a trainer, a PT,
Mhm.
an OT.
Until I started here, I would never thought about backward walking.
I know. You're like, what?
You know,
You're like marching in place.
Yeah.
exactly.
That's weight bearing.
Eyes closed. You're
Get
like,
your
what?
straight up a little
Or the
bit,
side
you know.
walking, you know, I
It's a
mean,
balance.
Right.
Who would think? I know. Yeah. But in reality, you do those little movements.
and we'd have all
Throughout.
been better off for it, I think.
Mhm. Yeah.
100%.
Yep. It's all just challenging yourself in different ways and keeping up with it.
There we go, keeping up with it.
Yes.
That's the tough part.
The accountability and the consistency
Yes,
is
yes.
hard.
Yeah, for sure.
Mhm.
Can I just throw one more thing?
Yeah, yeah.
So when we talk about not bending forward and twisting and reaching, things like you're driving down the road, you stop, your purse falls off the passenger seat onto the floor. What do you do to pick it up? You do
Yep.
all three of those things to put it back on the seat. So there's a ton of things you do every day.
The dishwasher, I always
The
think about.
dishwasher is one of the things I go through. The laundry, I go through all these things with our patients, daily activities, and how are we going to do it at your house, and how are we going to change your habits, your movement patterns. But the whole thing about those movement patterns is a lot of people don't realize that the segments of your spine that we're concerned about aren't the ones in the back of your spine. They're the segments in the front of your spine. So that pressure of bending forward is just, first it creates like little fissures, you know, and then they may become cracks, and then they become fractures, just from sitting like this. Okay, so I don't want to scare you, but I mean, it's the front of the spine that we're trying to open up and protect by not bending forward. So that's why they don't want you to bend forward and twist and go sideways, or we don't want you to do that.
Mhm.
That's interesting.
We work
because
on
I
those
never thought
posture
about
muscles.
the front of the spine.
No,
Right.
you don't really think about it.
No.
You always think it's the back of the spine, but you're actually trying to open this up and
Thanks for
protect
telling me
the
that.
front of your
That's
spine.
what we do.
Yes, so all that back
Oh, you guys can see
extensor
that.
strengthening